We are thrilled to have such a great crowd with us today. This turnout demonstrates the power of technology to boost our historical commitment to convening around big questions of quality of life in our community. So thank you very much for being here. Just over a year ago, as you know, we launched our strategic plan, the first since 2008, committing to our vision of building a more equitable, just, and vibrant Pittsburgh through coordinated collaboration. Some aspects of our plan are timeless. Our dedication to serving our donors and to facilitating your legacy of giving will always be core to what we do, as will supporting our community through grant making from our discretionary legacy funds. And if you haven't done so, please go to our website to learn about our areas of focus and our commitments to racial justice. What is new in our current plan includes an additional commitment, or what I think of as a third leg of our stool, that we call catalyzing partnerships, to fully and intentionally develop our relationship with you, our donors, of course, and our grantees and government, nonprofit, corporate, and foundation partners. We know that persistent societal problems of our time require more than any single institution, and that enacting change requires a wide-angle view, as well as the mobilization of community resources and leveraging cross-sector investments. We started with a comprehensive focus on safe and affordable housing because housing undergirds our commitment to meeting community needs on so many levels, and because we have a long history of engaging with strategies to support housing. I like to think of the Pittsburgh Foundation as engaging in an arc of housing issues, starting with a commitment over the last 5 years to prevent eviction, working now on the crisis of homelessness brought on by the pandemic, and moving toward a long-term focus on the current crisis caused by lack of affordable housing, which pinches the pipeline of availability and movement from shelters to supportive housing to affordable housing. About 10 months ago, we started working to understand the escalation of homelessness because we knew that the providers and case managers were at more than capacity and working as hard as they could. And we knew that in the rapidly changing landscape of our post-pandemic world, that successful solutions would require a variety of funding sources, people power, and in some cases, policy changes. We felt that as a community foundation, it was our unique responsibility to take the time to identify gaps and solutions. Quite frankly, we felt that we might be the only ones with the privilege to devote the time and attention to look for comprehensive and cross-sector solutions. So our team began by convening providers and the government and foundations that support their work and set out to understand what changes have led to the alarming rise of suffering in our community. And we convened repeatedly to determine what we can collectively do to respond. So the presentation you're about to hear represents not just research and analysis, but repeated and iterative convening. As you will hear, it brings us to an exciting moment of collaboration with the public and nonprofit sectors and a cross-sector cohort with the collective will to take action. This work meets our intent to catalyze partnerships in order to solve problems and create opportunity, and I am proud to share with you the talents of our staff teams. As always, we need you by our side. You have always provided the core of the Foundation's impact, for which we are deeply grateful. And with that, I turn over to Lindsay Aresti.
Hi, everyone. It's great to have you with us today. For those of you that don't know me, I'm Lindsay Aresti, Vice President of Development and Donor Services here at the Foundation. We're excited for the turnout and to tackle this great issue that I think a lot of us are seeing as we drive around downtown. And we want to call to action all of us to figure out how we might be able to help and assist with this crisis. So I'm going to go over a little bit of housekeeping, and then I'm going to introduce our featured speaker on today's event. So a few housekeeping items. Captioning is available for today's event. If you would like to enable the caption feed, use the closed caption button at the bottom of the desktop app or in the settings section on the mobile device. Today's presentation is being recorded and will be shared on the Foundation's YouTube channel. So if you have friends or others that aren't able to attend live in person, there'll be an opportunity to view this at another time. And questions, there are two ways that you can submit questions via the Q&A feature, as well as in the chat. My amazing colleague, Amy Razum, will be fielding questions towards the end. But please feel free throughout our time together today to drop questions in the chat or use the Q&A feature as part of the Zoom module. And with that, I will pass off to my colleague, Phil Koch, who is the Vice President for Policy and Community Impact. We've had the pleasure of working together for many years here at the Foundation, and he is our resident expert on this topic. So with that, Phil, thanks so much for joining us, and take it away.
Thanks so much, Lindsay. Appreciate it, and glad to be here with you all. As Lisa mentioned, I want to reiterate her sentiment of gratitude for you all taking the time to come and be with us. It shows us that you are also committed to finding real solutions for the folks in our community, our neighbors that are experiencing homelessness. And so I'd like to take you through some slides that will help you better understand why we're seeing an increase in sheltered and unsheltered homeless populations. Really want to think about how this is a moral and economic imperative to achieve these solutions. And then really what I want to do is to help us create a universal understanding of what the problem is, and then to end with what are some possible solutions and how can you work with all of us to find solutions to this problem. So let's go ahead and dive right in. So I want to start by talking about folks that you're seeing downtown. It's clear to us that there actually are three different population groups that you're seeing downtown that are causing what some people are calling disruption in our downtown area. The one is certainly homeless individuals, folks that are experiencing homelessness. That definitely is a group of people that you see downtown, and that's what we'll be focusing primarily on today. But often there's a misconception that there are other people that are in the downtown area that are there explicitly to use and buy and sell drugs. Now, that requires a different strategy to solve that problem than to solve the problem of those that are experiencing homelessness. So those are two different groups. And then the last is our folks that are coming downtown to panhandle. Again, we need to develop a different strategy for each of these groups. And often, because of the bias in which we're born with, we tend to want to clump folks together and say this is one large issue. But in fact, when you look at the data and you really start to peel back what's going on, we're seeing three different population groups that we need to come up with three different strategies. Rest assured, in conversation with the city and the county, they're doing a really strong job of trying to find ways to deal with the drug markets that are happening downtown. And that is, there's certainly some separate solutions for that. So there is people fully focused on that. But at the Pittsburgh Foundation, we find that our lane is really about focusing on our most vulnerable folks, those that are experiencing homelessness, and that's what we'll be focusing on today. Just want to bring this map up for you of places where we're seeing this type of disruption that I've described. So this is a map of downtown. Those that may have come downtown to the cultural district for some of our shows, for example, you may see issues with youth on the street being loud, or it might be that you see folks that are using drugs and those sorts of things. In Market Square, it might be different types of disruption, right? Around folks that are homeless or other people. Again, you've also seen that on Smithfield. So these are hotbed areas where we're seeing disruption. But once again, it's important to not just lump it all together, but to really figure out who are these folks and what do they actually need, and how can we create strategies to support those individuals. Let's focus on homelessness. When we think about homelessness, HUD actually separates it in the Housing and Urban Development, separates it into sort of two different categories. We think about it in terms of sheltered homeless. These are folks that are living in publicly or privately operated shelters. And then we also look at unsheltered homeless. So these are people that are living in places that are just not meant for human habitation. So you almost have those two separate categories. So we often may see people that are choosing to sleep outside, or if the shelters are full, they're sleeping outside because they can't get into those. So there's those two separate populations. So I wanted to take a moment to define that first. And it's also important to know that at the Pittsburgh Foundation, but also our housing advocates in our county, they lean into a strategy that's called housing first. So we know that some of the folks that are experiencing homelessness have other things that they wrestle with: mental health issues, trauma, addiction, lack of employment skills. These are all things that that make this a really gnarly issue to deal with. But the belief is that we first have to find housing for individuals so that they have a stable environment. And once though they can find that stability, we can then really start to dig into these other issues that they might be dealing with, such as mental health or trauma or addiction. So we adhere to a housing first policy, as does the county, as does housing partners across our region. I think it's important to take a moment to look at homelessness nationally. Where do we compare in Pennsylvania and in Pittsburgh and in Allegheny County compared to other places nationally? So as you can see in this map here, Pennsylvania is that light blue colored area right there, and so you can see that we're right in the what I would say middle of the pack, right? We don't have we don't have a small problem such as places like North Dakota, but we're certainly not don't have as severe a problem as places like California, Oregon, or Washington. And so we're right in the middle of the pack. And I want you to keep this image in your mind for a second as I flip to the next slide, which will show you the same data, but related to affordable housing. And the reason I'm showing you this is that if you look at Pennsylvania again, we're still in that lighter blue color. And when you compare it to places like North Dakota, affordable housing is not such an issue there. But when you compare it to places like California, Oregon, and Washington, we're not as bad or having as hard a time in affordable housing. So you're seeing the same trends in homelessness as you are with affordable housing. And the reason this is important is because one of the takeaways I'd love for you to walk away with is to understand that the issue of homelessness is an issue of housing. If we don't have adequate affordable housing and a variety of affordable housing options, then we can't get people off the streets. There is a clear correlation between the affordable housing stock that you have available and the levels of homelessness that you have in your community. So it's less about the individual and more about the systems that we have in place or don't have in place. So let's look more into Allegheny County now at this point. And this is a list of sort of where we've been, the trend lines from 2009 all the way to 2023, as you look at those that are experiencing homelessness, particularly in emergency shelter, as well as unsheltered populations. As you can see, you've got the biggest depth that you see, the change, I would say, is between 2017 and 2018. And you can see that purple line there, which is called transitional housing, drop down. Now that's a little bit misleading, and that's because the federal government changed the way in which they define homelessness, and they changed the way in which they define transitional housing, which severely dropped those numbers. So I'm going to suggest that instead we just look at pre-pandemic to where we are today. And as you can see, from 2019 to 2023, the number, the blue number that you see there, which is our emergency, those that are in emergency shelters, and the yellow number, the one that's the unsheltered populations, has increased steadily over the last 5 years. And this is for a variety of reasons. It's because we no longer have the rental assistance programs and dollars that we have available. Most importantly, it's because affordable housing continues, the cost for rents continue to go high and skyrocket, which then has a negative effect. And then you also have what I would say is a compounding of social issues. We're seeing more issues with behavioral health, more issues with substance abuse, and those things combined make it that much more difficult for folks to resolve themselves out of shelter. I want to share survey data from 2019 compared to 2023 for Allegheny County. So this is survey data of folks that have identified in what we call the point in time count when we go and survey to see who is homeless and unsheltered, you can see these are people that I've identified in various groups. I want to point your attention specifically to the last two, which is the substance use disorder and mental health. And you can see that the number of people that are identifying as struggling with substance use disorder or mental health has really, really increased significantly from 2019 pre-pandemic to today. So that tells us that that it's much more complex to provide services for those individuals, because it's not just about finding a house, but it's also about making sure that we have the social services available to give those individuals what they need. Before I move on from this slide, I do want to point your attention over to the left-hand side where it describes our focus on veterans. Those that are experiencing homelessness that are also identified as veterans in 2019 is much, much higher than 2023. So you have to ask yourself, why is this? What is the shift? How come one went down but the other didn't? And the reality is, it's about focus of resources. That in 2019, there was a coordinated and concerted effort nationally and locally to ensure that we don't have homeless veterans or that we don't have veterans on our streets. There was an additional resources that were poured into that work. There was coordination that went into that work. And what we saw was that it worked, that those numbers went down significantly. And what that tells us is that when we have good coordination and when we fully focus on solving an issue, this is manageable. And so we need to learn from those from how we dealt with our veterans and apply that across the board to our homeless populations that are experiencing homelessness and have substance use disorder and have mental health disorder. We can solve this together if we really focus and apply what we've learned from our veteran experience. I also want to note that homelessness in Allegheny County, that there is definitely an equity issue happening there. About 50% of those experiencing homelessness are identifying as Black individuals and our Black neighbors, as opposed to what the Allegheny County average is for the average population, which is 13.5%. And so we know that our Black populations are disproportionately affected by homelessness, which when we think about our strategic plan, certainly calls us to the table to address the problem. I want to talk about how this happens. How do people become what we call chronically homeless? So I'm going to separate this actually into two categories, and I'll walk you through how this happens. Some folks that we work with, we would say are situationally homeless, as opposed to long-term chronic homeless. So when we think about those that are situationally homeless, it's somebody where there was a specific event that happened that triggered homelessness. Maybe they lost their job. Maybe there was a domestic violence issue. Maybe there was an eviction that happened that wasn't anticipated for other issues. So those folks are immediately, put on the street, finding themselves without a home. And those that are situationally homeless actually account for the largest portion of people that are homeless. 80% of individuals are only temporarily homeless because something happened and they've now found themselves on the street. And that's particularly true with our youth as well. But the longer someone is on the street and the longer someone is without a home, the more likely they are to have complications, which leads to chronic homelessness. So chronic homelessness is a pattern of continual homelessness over a longer period of time. We know that folks that experience chronic homelessness are people that also have mental health challenges or substance abuse or may have disabilities. And a lot of it can actually stem from trauma. The longer that you live on the street, the more prone you are to experiencing trauma, and therefore you may slip into issues of substance use disorder, or you may develop additional mental health complications. And again, that accounts for about 20% of people that are homeless at this point. Again, what this tells us is that we really need to get in front of the problem and help people the minute they lose their home, because we're more likely to solve that for that individual and help them self-resolve. So I want to share data from January of 2023 of our unsheltered population. So once a year, they have what is called a point-in-time count, where volunteers and staff from the county go out and look to see who is on the streets, who's identifying as an unsheltered homeless individual. Where are they located, and where are sort of they consider home base? So you can see here on this on the map where those individuals are and how they're identifying. Notice that the total number of unsheltered is about 155. Downtown, where we tend to think is the largest issue, is identifying at about 17. That doesn't mean that folks from the north side, where you see the 46, or folks from the south, or from more the South Hills area, where you see 30, that those folks aren't coming into downtown. In fact, they are. A lot of our services are provided downtown. What they may meet colleagues or friends downtown. They may come here that's where the bus routes are all routed, is into downtown. So it may at any given point seem like it's larger than 17, but the problem is, but when you think about who actually is based downtown, we're hovering around that number. And the reason that's important is because, again, that is not a massive number. Those are not the types of numbers that they're seeing in Seattle or in California, right? These are very manageable numbers. It just, again, is just going to require all of us to roll up our sleeves and find solutions to those issues. But there's a lot being done already. Sometimes it can feel overwhelming, and it can feel like, why isn't the county solving this? Why isn't the city dealing with this? Why isn't the private sector or the foundations rolling up their sleeves? But in fact, there's a lot that's being done. So I want to start there and share that with you. But first, I want to be clear about whose job is it to serve our homeless individuals. So there's money that comes from federal and state sources into our region to address issues of homelessness. And so some of that money may go to the city, but the city's primarily responsibility are the following. First and foremost, public safety. Second, infrastructure. And third, emergency management. That is really what is on the county, on the city's shoulders at this point. The lion's share of supporting homeless populations actually falls on the county. The county, through the Department of Human Services, supports lots and lots of social service nonprofit organizations and behavioral health providers. In fact, they fund over 120 different programs in various neighborhoods to address everything from initial outreach to shelter beds, to supportive services like behavioral health or mental health services. And so the lion's share, again, of the money are going to those individuals. An interesting example is when we think about the encampments that you might see, the tents that you might see downtown. Again, it's the city's responsibility to figure out how do we keep people safe, and that they create code infrastructure, code enforcement on where those tents could be. But when we think about who should be doing outreach to ask those individuals to come into shelters, or to find new housing solutions, or to find out why they're creating those encampments, that's on the county side. So it's two different, the county and the city that have to work collaboratively with the partners that they fund to solve these problems. When the Allegheny County does have a homeless service system, it's called coordinated entry. When a homeless individual is going to enter into the system, it's first dialed into a coordinated entry system, and they look to see where they need to support that individual. Is it prevention and diversion? Is it immediate support like outreach or shelter, or is it through a housing program? That's sort of step one. And then I sometimes like to describe housing as a continuum. Now, let me be clear, it's not as clean as this as I'd like to describe here, but it is a helpful resource to help us think through how does someone go from being sleeping in a doorway to finding an affordable home. So when we think about sheltered homeless, it's, again, really somebody who's sleeping in a public space not meant for human habitation. So you might think of those that are in the encampment that was under the Smithfield Street Bridge for a while by the Mon River before the recent flooding that happened. Those are unsheltered individuals. Sleeping under a bridge is certainly not meant for human habitation. From there, what we try to do is really locate folks in shelters. So these are public or privately operated. There are 11 of them in Allegheny County. And a couple of examples that you might be familiar with would be Second Avenue Commons, which is located by the jail, the most recent facility that had been opened. Light of Life or Bethlehem Haven are a couple of other examples. From there, sometimes it's important to look for short-term housing. So a short-term experience. It could be something where they're able to go into a single room occupancy or some other with some limited supports as we try to figure out what's next. So the Center Avenue YMCA or the Allegheny YMCA has room, for example, that are meant to be that sort of bridge program. From there, we really look for supportive housing, and sometimes folks go directly or need to go directly from shelters to supportive housing. These are typically places where there are rent subsidies, and they're getting it for they're getting these places for a lower cost, but at the same time they're being provided some services that they need. Again, back to the housing first model. We get people stable in a home, but then we make sure that we've layered on things like mental health supports, job training, social services. I'd like to highlight Veterans Place on Washington Boulevard as a great shining example of this. Again, we poured lots of resources into making sure that folks that are living at Veterans Place, our veterans that live there, have everything they need to be successful. And we've seen tons of success there. And then last, we're talking about affordable housing. And affordable housing can happen in lots of different ways. We define that as that the occupant is paying 30% or less of their gross income on housing. So this could be anything from the housing voucher program or Section 8 subsidized house. It could also be naturally occurring affordable housing. Typically, we're seeing this a little bit further out, places like the Mon Valley, for example. Let me just one other piece here on this slide. As you can see, the supportive housing has a little bit of a dotted line, and that was intentional. The reason that we put a dotted line there is that we're seeing that is where the biggest gap is right now. If we had more supportive housing, we would be able to more quickly move people out of shelter and into those resources. But Pittsburgh has just not developed the level of supportive housing that we need to support the number of folks that are currently in shelter. Again, demonstrating for you that that the homeless issue is also a housing issue. So let's dig into sort of what is being done at this point, though. I'll start with the public sector. So again, as I mentioned, money does come into Allegheny County Department of Human Services to support the myriad of programs that they have. They are supporting nearly 4,000 different types of beds, from supportive housing, transitional housing, everything to the shelters that you see. So that is where the total of the 44 million about goes. Is not only to support those 4,000 beds, but also all of the social services program and outreach programs that go to support this issue. I also want to note that there was a lot of press about last year around Smithfield Shelter. The DHS was successful in closing Smithfield Shelter, which frankly was over capacity, and the infrastructure of that facility was not up to par. And they successfully were able to place 145 individuals that were using that shelter on a regular basis in either new shelter programs or directly locating them into permanent supportive housing, which was great to see. Again, at this point, we have 640 emergency shelter beds, and that is scattered among 11 different sites throughout the city, some downtown, but also in other neighborhoods around the city as well. There also was the creation of the new public safety center by the city, and that's on Smithfield by the PNC, and that also included funding from PNC, a good public-private partnership. And Operation Safety Net and other street medicine initiatives have been implemented in the last year, and at this point can now be reimbursed by Medicaid, which was a state decision, which really helped alleviate some of the budgetary concerns around street medicine. The private sector, though, is also stepping up, and I want to highlight some of those things as well. So Second Avenue Commons is a great example of that. PNC and other private partners worked hand in glove with the county to create Second Avenue Commons, which is a shelter facility, but also has a healthcare clinic and daytime operations for people as well. Great example of a public-private partnership. Our foundation partners have definitely stepped up to the plate. I just want to call out one of those, which is the Hillman Family Foundation, who committed $5.4 million to address issues of homelessness in partnership with 6 nonprofits to help deepen their capacity to address the issue. The Pittsburgh Downtown Partnership established an ambassador program to identify folks that are in crisis and immediately coordinate with DHS to call them in to help support, give them the supports they need when they're seeing these problems downtown. The county also piloted a van program with the Pittsburgh Downtown Partnership with funding from foundations that would help transport people from downtown to the resources they need. So if they were experiencing homelessness and couldn't get to a place that had food or the mental health services, we now have vans that are rotating to pick folks up and bring them to the places that can provide what they need. And finally, Allegheny Health Network established a program called the Roots Program, an outreach program for resource navigation, and that soon will actually be transferred over to the city from Allegheny Health Network. And finally, I want to note some new development that's been happening. One I would note is the Allegheny YMCA on the north side. They have a single room occupancies that hold 65 individuals. And that facility that is now being developed and renovated will have wraparound services for those individuals, and it truly is a community setting to support those folks. You've also got a new development downtown, right next to the Red Door, if anyone knows where that is, on the Boulevard of the Allies. Catholic Charities is moving their offices right on the Boulevard of the Allies next to the Red Door to create what they're calling the Compassion Corner. It's an all-inclusive downtown facility for mental health and behavioral services, medical and dental, and an employment training center, so that folks that are getting their food, for example, at the Red Door, or getting their hot cup of coffee, can go into their facility, meet with a caseworker, and start to find the programs that they need. Gift of Mary is a women's shelter that will also be associated with Catholic Charities, and again, right near that corner there by the Red Door. That will be a shelter for women experiencing homelessness or domestic violence. And then also want to call out a creative solution. The Vincentian home in Morningside had been empty for quite a while. The county is now working with Action Housing and others to convert that old empty nursing home into single room occupancies for people that are in shelter, that again are situationally homeless and just need somewhere to go to get back on their feet. May not need a ton of supportive services, but it'll then give us an opportunity to get folks out of shelter and get them a little bit closer to stability. Let's talk about the gaps. Where do we see the greatest need at this point? So I've identified the challenges into sort of three groups, and I'll start with this what we're calling system issues. So we know that the last time that the county relooked at the way in which we address homelessness was pre-COVID, and we know that COVID has offered up a myriad of additional issues that we weren't anticipating. Again, the mixing of mental health problems with our substance abuse problems, employment issues, rent subsidies. All of these things are issues that are a little different now in 2024 than they were back in 2019. So there is definitely some challenges on the plan on how we plan to work with our homeless populations. The one I think is most important that I want to demonstrate here is the second bullet point. The average length of stay in shelter has increased by 40%. So we need to figure out, how do we accelerate the flow of people coming out of shelter? So, for example, if you had that 80% that are situationally homeless and they're going into shelter and the average length of stay was 5 days, now it's much, much greater. And if you can't get people to move and resolve out of shelter, then you're going to see more people that are unsheltered on the streets. Some people think that the solution is to build more shelters. I would say that the solution is actually on the other end. We need to come up with additional supportive housing options, single room occupancies. We need to deal with the housing issue. Otherwise, we're just putting a Band-Aid on this larger issue. We need to figure out, again, how to accelerate the flow of people self-resolving out of shelter. And finally, we need to strengthen strategic communication amongst all of our providers, the city, the county, nonprofit outreach workers, law enforcement, there could be definitely ways to strengthen the system of communication there. The second group of challenges that I want to identify are increased needs for services and efficiencies. So right now, there is not a unified case management system for all individuals that everyone can access. So you can imagine that, think about the first outreach to an individual that might be sleeping in a doorway downtown, that an outreach worker talks to them and tries to start to resolve that problem. Well, by the time they get to a shelter, that may be a different organization completely. And that organization may not know what the first person did. And if they move from shelter to a single room occupancy, that operator of the single room occupancy may not know what they did in the shelter and what services they're being provided. So coming up with a unified case management system would create some efficiencies that could show great improvements. The other thing to note is that there's significant burnout and turnover in outreach workers and case management. This is a hard job, and we're getting young employees that are not paid a living wage, that are trying to work in these capacities, and so there's constant turnover and burnout. Therefore, we're not at full capacity. If we can't maintain workforce capacity, we can't fully implement all of the solutions. And finally, there is a need to increase a need for an increase in the coordination among those specialized services. So oftentimes we see that the substance abuse treatment providers are not in full conversation with those that are maybe doing healthcare work or mental health work or employment. So there needs to figure out how we can blend those special services and coordinate those together. The last bucket I would mention is really about the broken pipeline to housing, and you've heard me say this earlier. Again, there is a lack of supportive housing and single room occupancies. People are not leaving the shelters because there's nowhere to go. So that definitely has to be solved on the pipeline issue. And again, there's a lack of affordable housing, which is, again, further up the pipeline. And so we need to address that as well. So let's talk about what can be done. There are certainly solutions that we've identified, and I want to share those with you today. I'll start with a series of short-term solutions and then talk about ones that are a little bit more in-depth. The short-term solutions are things, for example, that the county is working now to start to figure out how to develop. One, for example, is immediate diversion funds. So if you, for example, had someone who came into a shelter situation and the reason they were in the shelter is because they just needed, they could self-resolve, for example, if they could get to their brother over in Cincinnati. If we had flexible funds, we could buy a train ticket to get them over to Cincinnati so that they can get to that relative. That would quickly resolve the issue if we had flexible funds for immediate diversion, immediately help that individual figure out a solution so that they don't have to stay in the shelter. The second is to pilot a program which I would call sort of a reconnection program. How are we really talking to individuals to understand who they could reconnect with in their life? Is there a distant cousin? Is there an old friend? Is there a relative that we can make that connection and help to heal that relationship so that we can lean on on families and friends to help with that work? We could strengthen the employment assistance support that we provide. Often, we're focusing on mental health or behavioral health. Can we provide that same with the employment assistance? We could certainly invest in the capacity of organizations to address those issues, the workforce capacity issues. I'd also suggest that we could look at technology solutions. There are lots of ways, and we've seen in other communities where they've leaned into developing new technology solutions to help various providers collaborate with each other on those individuals for a case management service, for example. So there may be a tech solution there. We could pilot programs that address issues of burnout and staff retention. Is this bonuses? Is this student loan forgiveness? We can certainly figure out creative ways to keep people in the workforce. We also know that we need 24/7 drop-in centers. We have some of that in Pittsburgh, but not a ton. So how can we create places for homeless individuals to go during the day so that they can do something that may help them develop, may help them address issues that they're dealing with, and then it also provides a safe place for people to go. We also will need an increase in the rental assistance dollars. The money that had been created through COVID by the federal government to help us do rental assistance is running out very quickly, almost all gone at this point. And so if we're going to help prevent homelessness, we need to make sure people stay in their homes if they need rental assistance dollars. And finally, there are a number of us that need to continue to lean into lobbying efforts. I do that in my role in public policy at the foundation to help increase resources at the state and federal level that are available to help us accelerate how we're creating affordable housing and affordable housing solutions. And then there are also long-term solutions. So for example, as I mentioned, we really need to think about supportive housing and how do we increase supportive housing options, both for those that are situationally homeless and for those that are experiencing more chronic homelessness. The county has actually a new initiative called 500 Homes in 500 Days. They're just launching it now. The idea is how can we all get around the table and figure out how can we identify 500 properties, rental properties that can be subsidized through rental subsidies, identify those 500 homes in 500 days so that we can identify people in the shelter system that don't need a ton of supports that we can put in those places to help unclog the shelter system. So the county's really leaning into the 500 homes in 500 days. I think it is a solution that could be really helpful. And then the last, again, is a long-term issue, which is how do we keep our eye on the prize, which is fixing the affordable housing issue so that the backups don't happen. And finally, we need a system revamp, right? How can we get people around the table, learn from what other cities are doing, and really rethink the way in which we're doing this to develop cross-sectoral solutions in this sort of new era in 2024, as opposed to operating on our 2019, the way in which we operated in 2019. So I want to take a moment to talk about opportunities to invest in solutions. The Pittsburgh Foundation, I'm going to suggest 4 different action steps that you might want to consider that we are now working with our private foundation partners as well as our corporations to articulate, to come up with one kind of unified strategy of ways in which people can invest in the future of this work. So I'll start with our action step number 1, which I call our pooled funding for innovation. You heard me talk about various ways in which the county is trying new things to help accelerate the flow of people out of shelters. This is really pilot programs and programmatic support. So we're thinking about things like additional supports for coordinated street outreach, or the immediate homeless diversion fund, as I talked about, or the relative reconnection program, or even to strengthen our drop-in centers. So we're working with our with others to try to pull this together, and our fundraising goal for this is about $5 million. Having those flexible funds for the county to try to implement these programs would be really helpful. Just to underscore that, when I talked about all of the $40+ million that goes to the county, that money is when that money comes with strings, and it's very specific. It says this money has to be used for this, X, Y, and Z. So the county actually has very little wiggle room in terms of how they can move those funds around to do something interesting or innovative or new. And so as philanthropy, it gives us an opportunity to really step up and think about, how can we provide dollars that the county can use as flexible dollars to really go after some of these innovative solutions. As a second step, we could really support those that are situationally homeless. Again, those are people that don't need a ton of supports, that just need to get back on their feet. And I would suggest that we should be supporting the county's 500 homes in 500 days. So again, these are flexible. What we're trying to do is to raise funds that can really remove any development barriers that the county confronts to accomplish this goal. So we're not suggesting that we need to do fundraising to flat out buy 500 homes. That's not the plan. There are lots of capital stack ways in which they're working on that. What I'm suggesting is that they're going to come up against roadblocks, and having some flexible dollars to help them get over those roadblocks could be really helpful. So our goal here is to raise about $1 million to help make sure that the county has the funds they need to get through those barriers to be successful in creating their 500 homes in 500 days strategy. A third action step we really want to also focus on our chronic homeless. These are the hardest folks to work with because their issues are complicated. And what we've done over the years, how we've done this in the past, is that the development of the homes in which are there to support those individuals, that pipeline of housing has been created separately from the services and how we think about the services. And then we find ourselves at the end trying to marry the two to say, is this housing solution something that we can add on these supports that will be helpful? The Pittsburgh Foundation is now committing to take the lead in an effort to strengthen the development of that pipeline with for highly subsidized housing with those deep supports. And so we're just now starting to convene people around the table to look at that really hard issue to tackle. And we've hired external national consultants to help us think that through and to think through the next step. We're only at phase one at this point, and I would say phase one to kind of pull people together to start to develop that plan is about $500,000 that we're pulling together. Again, just to get that ball rolling, to start those conversations. Again, we have to solve this problem. This will be a longer term effort for the foundation. And then finally, I would be remiss not to encourage you all to invest directly in our service providers. As I mentioned, they all are dealing with capacity issues, and they all need additional staff and additional resources to reach directly out to individuals. I'll name just a few, but this is not certainly an exhaustive list. So for outreach, people that are on the streets every day, working with our homeless, giving them what they need, inviting them into service. We're talking about organizations like Bridges to Mountain or Community Human Services. The Red Door certainly is a great resource. And finally, Pittsburgh Mercy. As I mentioned earlier, though, there are also organizations that are developing these new programs, these new capital facilities. So as I mentioned earlier, Catholic Charities and their Compassion Corner really will be doing some transformative work to invite people off the street into their facility to connect them with a case manager and give them, dental services, health services, employment services, all of those sorts of things. And then again, the Allegheny YMCA on the north side, developing the single room occupancies and redoing, they're in the capital campaign mode right now to really raise the funds that they need as well. So for direct outreach, these are organizations really doing great work. Your donor services representative can certainly help you learn more about these individual organizations and figure out how that could be how you might be able to help them. So I just want to finish with our sort of next steps and remind you of some of our cross-cutting solutions. Again, system adjustments are needed to accelerate the flow of individuals through the system. And there are immediate solutions to invest in, as I described. But it will take cross-sectoral collaboration to do this and achieve shared prosperity. Solutions just don't rest on the shoulders of the county and the city. It's going to take all of us to roll up our sleeves and to find solutions to this problem. There is a moral and an economic imperative to find these solutions. And this is a manageable problem, a solvable problem, if we're able to, again, work collaboratively to find those solutions. And of course, your help is needed. So I appreciate you listening. Again, happy to take questions. And I want to kick it over to my colleague, Amy, for our Q&A portion.
Absolutely. Thank you, Phil. We did get some really great questions in the chat and also the Q&A box. So I'm just going to start peppering you if it's okay with you, Phil.
Great. I'll do the best I can.
Wonderful. What policies are currently being considered that will support this work that's addressing housing and homelessness?
Yeah, there are a number of policies that both the city and the county are creating. I'll start with the city. The one that you've probably seen in the paper the most is a zoning issue. There are some of our city council members that were interested in creating a zoning area downtown that would allow an encampment to happen, so that there could be a concentration of where those tents would be, or there was a solution of tiny homes on that property, so that there could be some concentration of services. There certainly has been some pushback there as well, from some providers. So it's a little bit of a controversial policy. At this point, we want to make sure that the city and the county are doing their work to vet out that policy and trust that they're doing good work there. And so we'll see where that lands. The other thing that I might note is that we do have a new county executive, Sarah Inamorado. The county executive understands that this is a major issue and is in the process of hiring a housing director that will be situated at the in the county executive's office. That's never happened before. Before at the county level, the human director, the human services would do some, or the health department might have a little bit to do with it. Of course, you have the housing authority, right? The county housing authority. What County Executive Inamorado is saying is that this issue of homelessness and housing is so important, we're going to place someone in the executive office to help coordinate all that work. So I think you're going to see some policies that are starting to be developed out of that office that could have some significant impact on our work as well.
Great. Thank you, Phil. Interesting question. Do you know of any programs that are being considered to incentivize employers to provide temporary work or income to homeless individuals wanting to get back to a quality of life?
There certainly are. I've seen some micro programs. So, for example, there has been some suggestion, for example, of a corporation that was trying to figure out whether they could temporarily employ homeless individuals to clean up a stadium, for example, or do some of that kind of work, or help with downtown cleanup work. But I haven't seen anything that has been fully developed. But what I would say is that type of thinking is exactly what we need. We need folks that are really thinking about how can corporations come to the table to help solve this problem as well. And it may not be, just their corporate philanthropy, right? It could be that they help collaborate with the county to develop this type of program. So would love to have more conversations about that, because again, that cross-sectoral thinking is what's going to get us to real solutions.
Yeah. All right, another question. How does the borough and township structure of the city and county delay our progress in freeing up affordable housing solutions? And on the flip side, does that structure provide any advantage to trying to address this type of issue?
Yeah, it's a great question. I think our biggest barrier, in some ways, our biggest barrier is issues of zoning. I've heard that multiple times from developers. I'm not an expert in that work in terms of I'm not an expert in that work, but I can tell you the feedback that I've heard is that because of the complex zoning problems that we have, it just takes a very long time to get things through and to get things approved, which then slows that process. So I would definitely say that that's one part of it. I would also say that there on the rental side, there's lots of habitability issues that are happening, and every borough has every borough is a little bit different on how they approach that. The county's a little bit the county does not have, for example, a rental registry where we can ensure that those that the places that people are renting are in good shape and are habitable. So without a rental registry, it can be really difficult to figure out sort of what are those solutions across the board. And then in terms of opportunity, I would also say that it would be great if we can continue to find some incentives for landlords to participate in our voucher program, what we used to call our Section 8 program. It's been becoming harder and harder to find landlords that are willing to participate in that, and that's because again, the rental properties, the demand for them continues to increase, and so what we call naturally affordable or naturally occurring, rental rates, right, continue to rise. And so if a landlord can get a high rent on the open market, then they're more likely to do that than to participate in a voucher program from the housing authority. So what that means is we've got lots of vouchers that are being unused, not because there isn't need, but because we can't find landlords. And so there's an opportunity there to sort of think that through a little bit and to say, are there some incentives we could provide for landlords to participate? What might that look like? So I think there's a little bit of work on the policy side there as well.
Great. So 4 minutes left. I think we have time for 2 more questions. And for those of you that submitted, if I didn't get to your question, we will get back to you. So please rest assured we will be reaching out with an answer. What type of relevant technology solutions currently exist, and or what tech solutions are under development? And do you know who's doing this work?
It's a good question, and I don't know if I have a full answer for you. What we've discovered is that there is, I talked a little bit about the case management system, right, and the need for a case management system. I can tell you that what we've learned is that the county does have a case management system, but it tends to be underutilized. It also is hard for that case management system to be used because of the turnover that we're seeing. So if you have a case manager that's only, that's jumping into an outreach role and they're only there for 11 months, and you're constantly changing employees, and then you're constantly trying to have to train employees. And so therefore the system isn't being used to its full capacity, if at all, right? And on the other side, we're seeing some organizations that have their own systems. And so they say, well, I'm not mandated to use that system, so I'll just use what we have internally. And so there's an opportunity to develop that and grow that. But would love to have conversations, if folks know of good solutions. Again, we've seen solutions in other cities, but there is not something that's currently being developed at the county level. Here in Allegheny County at this point, again, I think it's one of those challenges where we could certainly lean into that and work could be done.
Great. And our last question, this is actually a twofold, and I think Lindsay might be able to answer part of this question. So how will the foundation continue to update donors as this work progresses? And is the foundation committing to working on this issue beyond this initial crisis response? So I'll let Lindsay answer the donor part of that question, and Phil, if the foundation is committing to working on this issue beyond the initial crisis response.
Happy to do that. Lindsay?
So I would say that our donor services team is well aware of the different options that Phil outlined in the webinar of ways that we can align together and support. And so if you feel compelled to partner with us on this issue, please certainly contact your donor services representative or contact me, and we can together come up with a plan to align with one of the strategies that Phil outlined earlier to support, which kind of leads right into you, Phil.
Great. Yeah. Thanks, Lindsay. I would say yes, the foundation is committed. Coming out of our strategic plan, one of the things that we established is what we call internally our primary impact area. So it's the idea that we need to really think about what is the most critical issue facing our region, and we've identified that as housing, both in terms of those that are really struggling, homeless, those that are renters that are that are being evicted, also the development of affordable housing, and frankly, home ownership, particularly for our Black families that are completely underrepresented in that work. And so we right now we're in the process of developing the Pittsburgh Foundation's 3 to 5 year plan to really lean into our housing work. So yes, I think that this hot button issue illuminates that need right now. But for us, it's just the beginning of a long journey to address housing in our region, and that includes supporting homeless populations as well.
Wonderful. Well, we are at noon on the dot. Thank you so much, everybody, for joining us today. And again, the recording will be up on our YouTube channel. If you need the link, please reach out to any of us. All of our contact information is on the Pittsburgh Foundation's website, so please don't ever hesitate to reach out to any one of us. Phil, thank you so much for taking time today. I got a couple messages that this was just so incredibly helpful and very informative. And so we very much appreciate your work on this. Thank you very much, everyone. I hope you have a great day.